This is a lesson on body movements, and in this lesson we're going to ask ourselves, how do we classify the motions caused by the interaction between muscles and the skeleton? We're going to cover basically the causes of body movement and then the different ways that they're classified. And there's two categories: ordinary versus special movements. Now, and in this lesson we're going to cover all of these vocabulary terms. Now, movement, generally speaking, is attained by the muscles acting on your bones. And it's not just a single bone. Every muscle essentially is anchored at 2 points or 2 bones. And really, the action of that muscle, what it's doing is it's bringing those 2 bones either closer to each other or further apart from one another. Okay, so generally speaking, the attachment points of a muscle can be classified as 2 ways. One is called the insertion. It's the attachment of the muscle to the movable bone. Generally speaking, this is where the bone is basically cemented to that muscle. It's really stitched very closely. And then the more stretchy part of the muscle, which is it's not really the muscle itself, it's the tendon connective tissue that's linking the muscle to the bone. That is the insertion point. So this is still sort of attached by tendon, but you'll see over here that the type of tendon that's attaching the muscle to the bone is much longer and a little bit more flexible along the insertion point. But either way, insertion versus origin, for me personally speaking, that's not as important as realizing that based on the position of this muscle, if you shorten this muscle, you'll notice it kind of would drag this lower bone, the radius, up closer to the upper bone or the humerus of the arm. And another thing to keep in mind with body movements is this is just one muscle acting on the arm. Oftentimes, and along 2 bones, there's multiple muscles attached to them in different locations. So for example, this is the bicep muscle that helps bring the lower bone arm closer to the upper bone arm. Well, on the opposite end, there'll be a tricep that's connected from the back of the humerus and the back of the radius, that when it shortens, it shortens this way. It would actually bring this lower bone arm and straighten it out and move it down, which would actually help shorten the angle that's on the back side to bring the bone down. So a lot of complex movements between 2 bones often involve 2 different muscles or multiple muscles working together to allow that shift in motion between the 2 bones along that joint. Okay, so in terms of body movements, we like to kind of classify the body movements into a category called ordinary, and it's not really ordinary. I just like to think of it as more simple body motions that are more allowable to use as a term for multiple bone points in your body. So in this case, there's oftentimes body movement terms can be paired, and they're paired in a way to explain opposite ranges of motions. So we have flexion, extension, then we have rotation, abduction, and adduction, and circumduction. Rotation and circumduction sound the same, but they're actually different in the way that they work on the body and then the overall motion that they end up producing. Though sometimes people mix up the terms. Okay, so in this case here, flexion is flexing. So it's decreasing the angle of the joint to bring the 2 bones closer together. Oftentimes people like to flex because when you flex, the muscle that's bringing the two bones together kind of puffs up and becomes very pronounced and large, like you flex your upper arms to get your biceps to bulge out. And then extension is the opposite of flexing. It's straightening out that joint, the 2 bones along that joint. All right, and then rotation is just rotating, turning side to side in a circular motion. So let me show you some GIFs that kind of show this. So this is sort of a general picture that kind of shows you what abduction, adduction, flexion, extension, rotation, and circumduction may look like. But let me show you some GIFs that I think help make it more visible and more understandable. So in this case here, let's go over flexion. So this, when he brings his leg straight out, that would be what we call extension. When he brings his leg down, that would be what we call flexion. Pretty simple. All right. Sometimes we call something called hyperextension, where the joint bends further away past what we consider straight out past what we consider extension into what we call hyperextension. Generally speaking, we usually use the term hyperextension for people with joints that are done in such a way that allow them to bend further back beyond what is healthy for that joint. Generally speaking, a lot of people who work in careers that involve motion, so sports trainers and coaches and stuff like that, people who are like help diagnose people with movement conditions like chiropractors and stuff like that, what they end up doing is they tend to try to train people to avoid what's hyperextension, because even if you are capable of hyperextending at a single joint. So for me, I can hyperextend my elbows. So instead of just straightening my arm, I can make my arm bend back a little bit further than straight. It can be dangerous because you're putting more tension on your joint naturally that would actually over time cause weakness at that joint because you're overextending what your bones would naturally support. So here's an example of a back extension for people doing exercise. So in this case, this would be considered a healthy back extension. So he's straightening his back out. But in this case, this would be considered hyperextension, which may be desirable for certain kinds of exercises, but doing it constantly could be quite dangerous depending on the type of exercise you're doing. Now, rotation is basically the twisting motion of shaking your head, okay? So it's turning back and forth. So this is also considered rotation because the point of pivoting, the point of the turning motion is actually at their hips. Okay, so they're twisting. So it's sort of like a circle. If you have a circle on a straight stick and you're just twisting the circle along the stick, that's what's happening. And generally speaking, almost a lot of the rotation motion that we see here is done along the vertebrae. Okay, so your two vertebrae or your spine bones are quite capable of twisting to a degree against each other, side to side. Okay, now we have the terms abduction and adduction. So abduction means you're moving some part of your body away from your midline, and adduction means you're moving your body back towards your midline. And again, these are opposite paired terms. So in this case here, when we talk about abduction, it's just moving the one body part further away from your midline. Okay, now a way I like to remember abduction versus adduction. So, and this one may not seem like adduction. Let me see if it's obvious here. Here we go. But it's still adduction because you'll see that the overall arm bones are moved towards the midline. That still counts as adduction. So an easy way I like to remember abduction versus adduction is the two Ds are very similar to each other. So it's looking like they're like standing side by side. While the B and D look like 2 feet that are kind of, opposite to each other. So it helps me remember that the two legs or the two arms are moving in opposite directions from one another, meaning further away from each other, which generally speaking means away from the midline. Versus these 2 feet kind of look like they're standing side by side to each other, which means to me that you're bringing them closer together or you're bringing your arms or legs closer together to your body. Now, circumduction sounds like rotation. So what circumduction is, let me go back to the definition over here, is the proximal end of the bone is stationary and the distal ends move in a circle. Now, this is quite confusing. You see circle and it makes you think rotation. But circumduction basically means, like circumference means circle, is you're drawing a circle in the air with that body part, okay? So this is circumduction. You're moving your arms so that you're kind of drawing a circle with those limbs that you're moving. All right, so can you identify the movement body type that is shown at the neck between these 3 images? Now, if you look the one over here, this person looks like they're drawing kind of a semicircle with their head. Well, this person is just sort of bending their head super back, and this person is just kind of turning their head. And in this case, we have circumduction, hyperextension because their head is extended, but then they're bringing it further back than what's natural, so that's hyperextension. And this one over here is rotation. Oftentimes in like yoga programs or exercise websites, you'll see this as this exercise called rotating the head. But if they're a true anatomist, they would call it the circumduction exercise or the circumduction stretch. Okay. Now, generally speaking, the joints of your body are structured in such a way that they support the range of motion at that part of your body. So here are some classic examples. And oftentimes, certain types of joints can allow multiple types of ranges of motions. So ball and socket joints are actually, I would argue, the most movable range of motion that can be done in your body. And because it's a circle inside a cup. So in this case, you can rotate it, you can twist it side to side, and you can move it up and down. So it really supports abduction, adduction, circumduction, rotation even to an extent, and also flexion and extension depending on how you bend it. But it also means that these joints, because they have such a wide range of motions, they can be quite flimsy in a way, because they're held together by lots of flexible tissue that is also tends to have a higher chance of tearing if you move your muscle or your bones in such a way that your body can't handle anymore. A lot of athletes tend to have issues in their ball and socket joints or other complex joints that allow larger ranges of motion. Well, here, this hinge joints are muscles that you don't really, or not muscles, bones that you don't really have a huge range of motion. You can only really bend it, flex it, or extend it, and not much else beyond that. Pivot joints allow for rotation more often, sometimes a little bit of circumduction because you can tilt it a little bit. I like to think of them as, they're more like twisting. They're more like twisting because it's two circles along along an axis that allows for that turning thing. If you're wondering what these two bones are, this is those C1 and C2 vertebrae in your neck, and the C1 and C2 vertebrae in your neck really allow that twisting and turning motion in your neck. And also, to an extent, it works like a joystick, so it does also allow some up and down movement and side to side movement. All right, then we have the saddle joint, which also, as you can see with this one, it works sort of like a joystick in terms of the way it's positioned. And then we have gliding joints. Gliding joints are the most movable joints, but they're kind of the lowest amount of movable joints. They allow just a teeny bit of motion here, and you want to think of it as your vertebrae. So in this case, your vertebrae over here has a more immovable joint, but then the backside joint can tilt up and down just a little bit, but collectively along your entire spine, that can create a pretty large range of motion. And then finally, we have the condyloid joint, which also works more like a joystick as well. I would say it's more joystick-like than the saddle joint. And you can see that in that it's got a more circular kind of end. And this is one of the main joints that are found in your ankle and your wrist when the big bones of your forearm meet your wrist bones, and the big bone of your lower leg, the tibia, meets your ankle bones, the tarsal. All right, so motion on a joint in the body involves the interactions of group of muscles interacting together, like I mentioned earlier. And when we talk about special movements, though, these tend to be movement terms that are unique to a particular body part or characterize a complex motion using multiple movements at once. So oftentimes they're a mixture of like flexion and extension movements or maybe circumduction movements all together in a characteristic way that doctors or anatomists or anyone just may want to reference quickly. So we tend to use these terms quite often on major moving parts of our body, like our feet or our hands or our necks, that are very critical to treatment of individuals or diagnosis of movement issues in those individuals. So in this case, a lot of the terms we're going to be using quite often reference the leg, because the humans and walking, it's a very important evolutionary step for humans, but it also has resulted in a lot of mess ups in our body, and we have a lot of feet and leg pain as a result. So anyways, we have two special terms that specifically reference lifting or lifting or bending your foot. So in here we have dorsiflexion and plantar flexion. So dorsiflexion is lifting your foot so its superior surface approaches the shin, so just moving your foot up, while plantar flexion refers to pointing your toes down or away from the shin and increasing its angle. So it sounds like it's not flexing, but you are kind of flexing your back bones over here. Although you might think of it as extension of your toes compared to your ankle. All right. Then we have retraction and protraction. So a way I kind of remember is when I want to retract a statement, I want to take it back. So in this case, retraction means moving it further back towards your body than instead of further away from your body. Protraction sounds like protruding, and protruding means sticking out. So maybe if you know those English terms, that make more sense to you. So this is protraction and retraction of your jaw or the mandible. Well, this one is protraction and retraction of your shoulder bones. Okay? So in this case, you're bending your shoulders back versus you're bending your shoulders forward. So it doesn't have to be just your jaw. And just to kind of reiterate that whole thing with special movements, they tend to be referencing particular parts of your body, but they still involve those ordinary, quote, body movements that we talked about over here. So this protraction and retraction is actually a complex motion created by flexion and extension along different points along your spine, along the many bones of your spine. All right. Now we have the terms inversion and eversion to reference feet. And again, a lot of these terms have become specialized because they're used quite often because we have to diagnose mobility issues a lot in individuals due to strokes or developmental issues or just overuse of their body due to athletics. So in this case here, inversion means moving your foot the sole of your foot up and inward. And then eversion means moving the sole of your foot up and outwards. So that's a little bit confusing. So eversion means kind of allowing the angle and the underside of your foot to like face towards the outer world, while inversion for me is thinking about the bottoms of your foot kind of facing inward or the midline of your body. And then we have the terms supination and pronation. And again, these are terms related to the highly movable areas of your body that can be an issue. So we have supination, which is where your body part of your hands or feet are palm up, the underside of your hands and feet. And pronation is where the bottom sides of your feet or arms your feet or palms are bottom down, okay, or palm down in this case. I mentioned your feet. Your feet aren't used for supination or pronation as much because they're most of the time kind of on the floor or in the pronation position all the time versus your hand, which you can mentally choose whether it's palm up or palm down, and it can be in either position. These terms are more often used for surgery when you have to have a patient move into a certain position to allow you to do to gain access to the body for treatment. However, sometimes for some of you, especially those of you who run a lot, you might have heard of the term overpronation. And in this case, this is when the bottoms of your feet flatten out extra against the ground further than is healthy for your foot to support motion or walking without pain. So those of you who overpronate may be more prone to injury or pain in your feet arches than other people because your foot side down pushes even beyond and presses down to the ground beyond what is normal and creates some weird wonky walking motions as a result. And then finally we have opposition, which is just your thumb touching any other opposing finger on your hand. So opposition is due to those opposable thumbs, which you may have heard that term before. All right, so just in general, our key takeaways: the muscles attached to bone allowing action on a joint. No joint means no motions, meaning no two bones means no motion. We are 206 bones as an adult, and if you are only one bone as an adult, you wouldn't be able to move at all because movement is about moving bones against each other. Ordinary body movements typically classify motions that occur at one joint, while when we talk about specialized movements, generally speaking, we're classifying motions that are unique to a body part or include particular complex motions that utilize multiple movements in a particular area of the body. And many movement terms are paired in such a way that their meanings are opposite. Sometimes we call these antagonistic movements to one another. All right, that concludes the lesson. Bye.